Hi, everyone. I am Sarah Rodriguez, and this is the Rodriguez Report podcast. In Wisconsin, we take care of our own. Growing up, I was taught that we take care of each other. We take care of our friends, family, and neighbors. But what does that mean when it comes to healthcare in our state? In this episode, we're talking with Susan Ward. Susan's on the front lines of patient care in Wisconsin. And like hundreds of healthcare providers, she sees every day how barriers to our healthcare system make it harder for our loved ones and neighbors to get the care they need.
I see patients coming in every day, and it's hard enough to keep things controlled. And lately, in the past several years, I've noticed that someone will show up on my schedule. You go in, you talk to them, and you say, "Hey, how you doing? How have you been?" And frequently they haven't seen me in several years, and they tell me the reason is because they had no insurance. And whenever you have a gap in care like that, sometimes you can find chronic conditions that get out of control, like someone's blood pressure is high as a kite, or their diabetes is out of control, and their sugars are way higher than we'd like. And sometimes they're even symptomatic, where they're just not feeling well. And for the diabetics, they're thirsty. For the people with high blood pressure, they can feel their heart pounding, and it's really uncomfortable for them.
So because they were uninsured, because they weren't able to have something that would cover their primary care, that coming in to see you, they avoided care altogether. And that actually affected their health in many ways. So they were having all sorts of symptoms. They were not feeling well. I imagine it affected how many hours they could work at their job or how well they could work at their job. And so you've seen a lot of folks who've delayed care. Did that implicate in the cost of care overall? Did you have to do more expensive treatments because these individuals had avoided care because they didn't have insurance?
Oh yes, at times you have to use more medications to get their blood sugar down, to get their blood pressure down, than you would have if you had just been able to keep a consistent level of interactions, and if they were able to stay on their medications.
And I imagine some of those people would show up in the emergency department because they haven't seen you in a couple of years. Is that something that you've noticed as well?
Oh, yes. Oh, yes. Heart disease is the leading cause of death in Wisconsin. 1 in 3 deaths are either caused by heart attacks or strokes here in Wisconsin. And that's one of those chronic conditions that we desperately need to control. Otherwise, people die. And it's not just the death. There's also the disability that is incurred after these major events happen.
And all of this is preventable. All of this is preventable if people are able to access the care that they need. If they are able to get insurance coverage like Badger Care, we could prevent so much death, so much disability within Wisconsin. It just makes clinical sense to expand Medicaid, and it makes economic sense to expand Medicaid, all of those things. And as an old ER nurse myself, I can tell you that the emergency department is the last place that somebody should go for primary care, because that is not what an emergency department is built for. We're not built to do what you guys do within the clinics, which is follow people to make sure they're taking their medication, to make sure that they can have any questions answered that they have. When your care goes through the emergency department, you lose a lot of those support services. And so it's so important for people to be able to have a provider that can manage their care throughout their lives and not delay care because they're unable to afford it or they don't have the insurance coverage.
That's exactly correct.
And so how long have you been practicing as a nurse practitioner?
Over 20 years.
Over 20 years. Okay.
Over 20 years.
Yeah, you and I are similar. I have been a nurse for over 25 years as well. So you've seen so many things over your time that you've practiced. So how have you seen access to care change people's lives? How have you seen that from across your 20, 25 years of working as a nurse practitioner, over 30 years working as a nurse, how have you seen access to care change?
It seems like it kind of waxes and wanes at times. And right now, it's the last few years, it seems like it's been declining because things got much better once we had the marketplace where people could get insurance. We had a huge blip where we were finally getting people in, where we could get things controlled, and that was great. And then over the years, things seem to be declining again. And when people's work will change programs, and there's a lot of factors there, but the consistency is when people don't get the care that they need, invariably these chronic conditions will at some point get out of control. And sometimes we're able to get to someone. Sometimes we're able to get to that person who comes in after not having seen you for a while, and you discover that this person who had prediabetes is now a full-blown diabetic. You discover that this person who had high blood pressure now has an abnormal EKG and needs to go to the cardiologist and get a stent. And some of these things we can get to in time. Other things we can't.
So when you were talking about the marketplace, what you mean is when the Affordable Care Act actually went into place, people who might not have had insurance through their employer could get insurance on the marketplace and be able to pay for it individually themselves. And depending on their income, they might have gotten a subsidy. But because Wisconsin has not expanded between 100 and 138% of poverty, yes, you can still get coverage on that individual marketplace where you can purchase it yourself. But oftentimes people have pretty high deductibles, don't they, on the marketplace?
Absolutely.
And what does that do in terms of people who are trying to access care?
That throws a whole other monkey wrench into the game, because then people have some degree of care, but they don't really have the level of care that they really need. So then we end up trying to do as many things as we can in one visit, which can be seen as being efficient, but you also don't want to try to cram too many things into one visit. That's like trying to drive from Milwaukee to Madison in 30 minutes.
And it's a huge challenge to be able to try to do everything when you only have limited time.
Yeah.
So you've been this provider for 25 years. I imagine you've talked to providers in other states who have expanded Medicaid in their state. What are they telling you that this has affected patient care? What are they saying?
You can tell that there's a degree of relief that they can get people in. We can do our jobs. We can control what we can control. And it's frustrating for patients, and it's frustrating for us because we know what needs to be done. But sometimes I think we as providers feel like we have our hands tied. And the other thing that happens is we get calls from people saying, I'm losing my insurance next month. So then you scramble and try to get as many things done as you can. And with scheduling, sometimes you can and sometimes you can't.
That can be very frustrating for you as the provider, but honestly, it's worse for the patient because they're the ones that are not going to be able to get care. So when you talk to your colleagues in Wisconsin, do most of them support Badger Care expansion in Wisconsin or Medicaid expansion in Wisconsin? What are they telling you?
Several colleagues of mine, when I have mentioned possibly expanding Medicaid and Badger Care, they have expressed some degree of support.
Yeah, because it makes it easier to take care of patients. It makes it easier to be able to actually provide the care that you've been trained to be able to do. I know some providers, when I talk to them, say, yes, some people do have that insurance, that private insurance that's on the exchange, but because Medicaid would actually be able to pay for more of the care that they need. And if they have that insurance on the exchange, having that really high deductible makes it so people don't come in. If they would be able to be on Badger Care, Badger Care would pay almost, close to first dollar for some of that care. So they could get their diabetes taken care of. They could get their high blood pressure taken care of. They could be able to do these things. And
then there's also medication coverage.
Correct.
which can be just a humongous expense for people. And at a continuing education conference I was at, we were joking that the best medicine for a patient is the one they can afford.
Yeah, you're right. You're right. That is absolutely true. I remember, this is a story that I have before the Affordable Care Act was passed, and I was working in public health, and a woman had come in to talk to us. She was having chest pain. And she came into the free clinic that we had, when all really we do is screen within public health. We're not there as primary care providers. You know, we connect people, but we're not there to be able to treat them. But she came into the free clinic, got screened, and we realized that she was having a cardiac event. And we had to send her to the hospital. And this is a woman who worked every day of her life. She was 62 years old, had not qualified for Medicare, which is what you would qualify for at 65. And they had offered her insurance when they let her go from her job, but it was unaffordable for her. She was going to have to pay over $1,000 a month to be able to continue the insurance coverage she had. This is a woman who worked as an administrative assistant. She did not make enough money to be able to cover the premiums for that insurance coverage. And so we had to go ahead and send her into the hospital. She ended up having to have some procedures done on her heart, which was quite expensive, like you talk about. Yep. And at the end of the day, she actually had to declare bankruptcy. If we had had something like the Affordable Care Act at the time, once she was let go from her job, she could have gotten something on the marketplace, likely would have qualified for Medicaid in the state that I was in, and all of that would be covered. But it was just a real financial burden for her to be able to do that. And it affected her job prospects moving forward, having that bankruptcy on her background check. And it's just really unfortunate.
People declare bankruptcy for medical bills
all the time. All the time. They do. It is every one of the most common reason for personal bankruptcy is medical bills. And that's just so unfortunate. And I know you and I both live here in Wisconsin. We are true blue Wisconsinites, and we take care of our own, and we should be able to take care of our own. And part of that is making sure that people have the health care that they deserve, that they are able to come in,
absolutely,
be able to see the provider, and be able to make sure that they can get their conditions taken care of and the medications that they need. So, Susan, as that provider who's on those front lines, if there's one thing that you could let people know or take away from your experience, what would that be?
Oh, boy. If you have a chronic condition, control it. Do everything you can to control it. And that's both see your provider, take the medicines, but also work on your own lifestyle. Anytime we attack a problem from multiple angles, you have a better chance of success.
Susan, what would you tell policymakers about expanding Medicaid?
Please do it.
Do it now. This is something that we need in Wisconsin. It's something that we need.
Help us help people.
Help us help people. I like that. Susan, thank you for sharing your story with us. As we prepared for this episode, I thought about the Bruce Springsteen lyrics. I've been stumbling on good hearts turned to stone. The road of good intentions has gone dry as a bone. We take care of our own wherever this flag's flown. We take care of our own. And I keep asking myself, how does withholding access to healthcare help Wisconsin take care of our own? As Lieutenant Governor, as a nurse, I feel a responsibility to stand up for Wisconsinites when policymakers threaten their health or threaten their health care. Expanding Badger Care will not just save lives, it will transform lives. In the 40 states where Medicaid has been expanded, people who haven't seen a doctor in decades are now taking charge of their health. Workers with injuries or illnesses can get treatment and not miss work. Access to healthcare doesn't just improve health. It allows people to enjoy more freedom and independence, to work, to better care for their families, and to give back to their communities. I wish that Wisconsin had expanded Badger Care a decade ago. It would have saved our state billions of dollars and literally saved lives. But the advantage of going this long is that we have a lot of proof from other states, 40 other states to be exact. We see that Medicaid expansion helps control costs for healthcare and helps save rural hospitals. And we know that the federal government is committed to maintaining the 90% match. This is a smart investment. And folks, right now, we pay for this care when our neighbors end up in the emergency department with a stroke or a major heart attack. Reaching them at a point of prevention and getting them on preventative care is a lot cheaper. In rural and underserved communities, expanding Badger Care would be a lifeline. Too many people in Wisconsin do not have access to a primary care doctor. Many worry about being able to afford their medications. Many worry about their health insurance premiums, and too many forego health care altogether. Expanding Badger Care allows Wisconsinites to afford life-saving care, take pressure off of our struggling healthcare system, and keep friends and family from going bankrupt or having to refuse care because they cannot afford it. One of the best, most effective ways to get healthcare to friends and family who need it is to expand Badger Care. This has been another edition of the Rodriguez Report podcast with Lieutenant Governor Sarah Rodriguez. I want to thank each of you for tuning in and engaging for the full story. Please like and subscribe so you'll never miss an episode. And tell your family and friends to do the same. I'm Sarah Rodriguez, and thanks for listening.